Happening now, it's Heart Month, and we're working to highlight different heart health stories all month long. I learned about a new procedure at the Oklahoma Heart Institute that's changing lives for people at high risk for heart surgery.
That's why it's so groundbreaking and important, because it's the first such device that's a completely non-surgical way to replace the mitral valve.
Dr. Cameron Muhammad with the Oklahoma Heart Institute worked on the clinical trial for this transcatheter mitral valve replacement for the past 5 years. In December, it got FDA approved.
It's all done through the blood vessels, so we insert the new valve, which can get miniaturized, and it's inserted through the vein in the groin, the femoral vein, and directed to the heart under ultrasound and x-ray guidance, and then we implant it.
This procedure specifically helps people at high risk of heart surgery. Before, if they needed the mitral valve replaced, they'd have to do some form of heart surgery. And for high-risk patients, this could be very dangerous.
For lots of reasons, patients just weren't getting treated because, either they don't want it or the doctor that does heart surgery, the surgeon or the referring doctor realizes that, yeah, you've got a bad valve, you're suffering, but the surgery fix might be worse than what you're going through now.
Heart surgery takes months to recover from, but with this procedure, it only takes up to a few weeks.
Most patients stay in the hospital 1 or 2 nights and go home after that.
Jerry Klein was the first person at Oklahoma Heart Institute to get the mitral valve replacement after it was FDA approved. He says he wasn't nervous about the procedure at all.
Not at all, not with Dr. Muhammad and his team of experts. They made it very easy. They explained everything prior to, during, and after. So it was remarkable, really.
Klein is in his 80s, and he's had heart surgery before, so he was a higher risk patient. He says the recovery from this procedure was quicker.
I was in the hospital overnight, pretty much the next full day, for them to do some testing and monitoring, do an echocardiogram to make sure the new heart pump was working properly, and then went home, and just a few slow days, a natural thing with the anesthesia you get, but it wears off as time goes on.
Klein says his heart failure symptoms like fatigue and shortness of breath are improving. He encourages anyone who's curious to talk to the Oklahoma Heart Institute. Now, if you want to learn more about the procedure or other trials at Oklahoma Heart Institute, we have information in this story on fox23.com.